皆さん、こんにちは。北海道大学医学部医学科の宗方です。前回の OET スピーキングの練習第2弾に引き続き第3弾としてこの動画をお送りしています。OET の練習と関してはいるんですが、医療面接、英語での医療面接の練習といった方が正しいかもしれません。それで今回のケースなんですが、お父さんに引き連れられて救急にやってきた12歳の少年ということになっています。主訴としては腹痛ですね。あとこれに加えて微熱と悪心があります。で、お父さんが自分の息子が、症状から虫垂炎かもしれないということでちょっと心配していますと。で、このお話を聞いて、じゃあどういうふうに正しく対処しますかというのが今回のタスクです。例によって僕の実際聞かれてる中で話していることや言っていることが実臨床と離れているところがあるかもしれません。一応ガイドライン参照してこれに臨んではいるんですけど、やっぱり緊張して言おうと思ってることが出てこなかったりとか、話の流れ上ちょっとどうしても言いそびれてしまったりというところが前回もそうでしたが、やっぱりまだあるんですね。今後の課題として取り組んでいこうとは思うんですが、はい。で、前回の通り、動画見ている中で、自分ならこういう風に対処するのになとか、自分ならこういう言い回しを使うのになと考えつつ見ていただければ、自分が望んでるかのごとく勉強できるかもしれません。それでは皆さん動画の方よろしくお願いします。
Okay, hi, I'm Yuki, who is one of the doctors here. So nice to meet you. Just for confirmation, can I start with the full name and the age?
Yes, my name is Fred Smith. I'm
Smith.
51 years old.
Sure. And then you is his mother.
I used to be his mother. Now I'm his father. I had a sex change.
What? Okay. Sure. Okay. So, what seems the problem here today?
I think that my son is always normally very healthy. He was playing football with his friends yesterday, and then last night he developed a bit of a temperature. He got a really bad stomach ache. I thought it was because he'd eaten too many sweets and too many. He went to McDonald's last night, and we thought that was the reason why he had 2 cheeseburgers. Actually, 3 cheeseburgers, too many. I told him off.
That's quite a lot, yes.
The stomach ache, but look, you can see he's in pain, and it's really unusual because he's such a healthy guy. So what can you help out? He's got nausea as well, so that doesn't help. Again, that's why I'm eating unhealthy junk food, but really bad stomach ache and nausea and a bit of a temperature. I'm worried, and so is he.
I understand. So, okay, first and foremost, so you said this time the abdominal pain, the stomach pain seems a little bit abnormal. So, what makes you think so?
Well, it's really, he's really, it's very painful, and it's not going away. Normally, we gave him some Gaviscon, some indigestion pill. I think are fine for children. Anyway, we gave them to him anyway, and we thought that was, and that the pain would go away. Go to sleep, take some indigestion tablets for 12 hours, and then it will go away. But it's just it seems to be getting worse. If I'm honest with you, he's in real pain, and
I understand.
And the nausea is not going away either. So again, look, we're in A&E, and we've had to wait here for in a British A&E. We're unfortunately waiting for over 2 hours. And
I'm sorry for making you worry for a long time. I'm so sorry.
Nothing for you, but that's just normal here, and it means that the pain is getting worse. So we just need to try and sort it out.
Okay, so I understand he's going through a lot. So how about he's consciousness status? Can he speak properly and then he's alert?
He's alert. He's telling me help. He's alert. No problem. He's just
Okay.
a lot of pain.
Right. And then so you also said his
Right hand side. If that helps.
Sorry. Yeah.
Right
So you said his symptoms were fever, nausea, and tummy pain. So anything else you noticed?
No, not really. I think that's
How about his bowel movement? Can he go poop normally?
I think so. I haven't really asked him that question, to be honest with you. So I don't know the answer to that, I'm afraid.
Okay, understand. So yeah, maybe he, so there is a need for us to examine him very rigorously. But first and foremost, do you think any idea what is causing his condition?
Well, good question. I had my appendix out many years ago, and really painful experience. I was actually away on business, and it was really uncomfortable, particularly from home. And I think
see.
it'll be the same thing. He just seems to be having appendicitis. That's my unprofessional view. That's the reason.
Yeah.
But I need you guys to help with this and see what you can do to help him.
I understand. Indeed, given his conditions, appendicitis might, is definitely possible. But at this moment, we cannot rule out possibilities of other symptoms and other conditions. So we need further, examination. And so probably I think we need a blood test as well as ultrasound in order to rule out emergency condition, including appendicitis. So what do you think about this, this way to handle his condition?
You're the expert, so I have to leave it in your hands.
Okay, thank you.
I need you to tell me what to do. You just got to say, right, we need to do this, and we will follow your instruction. And
Thank you.
How long does it take to how long will it take before the operation takes place, or would he have his appendix taken out, or what do you do?
Well, so in case his condition is due to appendicitis, we are going to send him a surgeon who specializes in appendicitis. So it depends on it depends on him. But I suppose it won't take long because the surgery for appendicitis is one of the most common operations, all over the world, as you already gone through ages ago.
So will he have to? Do you think he'll have to have his appendix taken out, or does it have to be taken out, or can you do something just to
well, yes.
deal with it?
In regards to that question, we strongly suggest, it is better for him to remove his inflamed appendix in case his condition is due to appendicitis. However, if his condition is due to other conditions, not appendicitis, he does not need go under the knife.
Okay, all right. So your test will determine that. To be honest, I'm going on a golfing trip in 2 days' time with my some of my friends. Yeah. To be honest, it's once a year, and I was hoping to go away, but I'm being very selfish between you and me. But I just want to. I guess the test will determine what you're going to do.
Yeah, it depends on the result of examination, which we gonna do.
Okay.
So at this moment, we cannot say that, but we're gonna do our best to get along with your idea and then your request.
Sure. Okay. So how long will it take for these tests? How long will it take for the tests to take place, and how soon do you get the results?
Okay, so just also blood test and ultrasound, it will not take long, probably within 1 hour, I think.
Yeah.
However, the caveat here is even his condition is not appendicitis, and then other conditions can be detected by ultrasound as well as blood test, we do need other type of imaging examination like CT in order to rule out other conditions. So if he needs to go for that type of examination, the time which we will need is gonna be longer a little bit.
Okay.
Is it okay with you?
Very clear.
Sure.
Great.
So, any questions you want to ask me?
I think you've answered all my questions. So, let's just get going.
Okay. So, now we've discussed your concerns and his condition. So please recap what we discussed. He has been brought into this emergency department because he complained of stomach pain, stomach ache, temperature, and nausea since yesterday.
Okay.
And then, so you are worried about his condition might be due to appendicitis. Of course, it is possible, definitely. However, his diagnosis can be different based on the result, which is going to the result of examination, which is going to through. And in case appendicitis, he might take a surgery. However, in case other conditions, how we going to treat him is gonna be different. But most importantly, whatever it is, as soon as we get a diagnosis, we are going to let you know. Is it okay?
Yeah, that's fine. But just let me know what you done so far for this child. What examination done so far?
Okay, so actually, I just had a conversation with his parents. And we elicited some important information about his condition. So as for examination, we still have not done yet anything, to be honest. But we are going to tackle immediately because his parents also have given us permission.
Okay. So the parents give the permission to examinations. And now,
Yes.
So what kind of examination you plan to do?
First and foremost, we're going to take his blood samples in order to assess a variety of conditions, especially sepsis or other infectious diseases. At the same time, because his parents are worried about appendicitis, we are going to conduct ultrasound echo test. And then if these methods cannot reveal anything, we are going to CT probably.
Yeah, that's fine.
Okay.
Okay, that's fine. So you're done. So now it just need to be just a quick stop for now. So it's a really short session today because it's gonna be the scenario that's gonna be simple, but sometimes it's gonna be the pediatrics appendicitis diagnosis. It's quite be complex because the kids maybe they're telling not truth. Okay, it's really difficult. If it's today, it's a really short session. It's quite be fine for me. What do you think, Don?
Fine. I think that just the my only comment would be that maybe it's different in Japan, but perhaps in the UK, in the NHS, you're probably overly polite and saying, "Is that okay?" Whereas I would actually say, "I'm going to do this and this." Okay. So that's just I think an NHS culture where there's just not time, and you're in A&E. And that's something you'll learn when you're in the NHS, if you are working in it. And it'll just have to be boom, boom. I'm guessing.
Yeah.
It's going to be.
I think
this is what we're going to
be...
do. Is that okay with you? Okay. and do you have any questions? And then you get cracking. So it's just you got to put it away. There's no, because you're the expert, so you're going to tell the person what you're going to do, and of course make sure they've got questions, but just do it in a active manner, so they know you're the boss.
Okay.
The infection control, information. How can I say it? Informed consent style is completely different. So when you explain for the parents, you have to need to be okay. So this is what we need to do. You're going to just need to tell for patients and the parents. We're going to do. I understand that you're worried about appendicitis, but what's the first what you need to do for blood test, and you just need to check the inflammatory level and information, infection control, the infection septic screening, which we need to be done, and also we're going to just organize for the CT scan for echo, and we try to find out what exactly caused, and then we just need to discuss about for what's the results. So that kind of information, you just need to be slow. So this is sometimes the information just keep on jumping out. If you have 5 minutes on actual test, it might be just because time is running so quick. So that's maybe that when the examiner said, okay, Yuki, what you try to want to say.
I see. Yeah.
Tricky in this scenario.
It's a really tricky scenario.
Tricky now because we're you in your flat and we're here, so it's different. But it just imagining that you're in a busy environment, I guess.
Actual environment is probably of even the ward round, but if it's a consultant, when the ward rounds, each patient, be honest with you, 5 minutes. Actually 5 minutes. Look, most of the consultants, hello, good morning, are you okay? Yes, and it just disappears. Okay. But the junior doctors, and then just after the follow by. So
totally. Yes.
Just how often coming to the patient bedside, how often clear the discussion, and sometimes the patient family call and what exactly plan for. Then most of the nurses dealing with it. But if any complex, any decision-making questions, of course, nurses will transfer to the doctors. Okay. So that is really tricky. So that period you have enough time, but I would say 15 minutes because you might be able to. So just think about when the time management, you might need to practice how quick, sharp to clear talking to the patients. Because the patients be confused. Oh, okay, this doctor said this, but other doctors said it different. Or I can't understand what the doctor's saying. And sometimes the medical words, when they talk to the patient, it might be no clue. Okay, even if I'm talking with maybe explained for the pediatrics patients, appendicitis, some kids might not. Okay, so that's what exactly you need to, how to just a different word to explain, not using a medical word. So you have if the pediatrics example of appendicitis, you're very bad bags on your tummy, so we just need to clean out to support it, or something like that. That kind of alternative, like make it just a little bit more fairy tale story, fun story to the kids understand. Yeah.
For kids, vocabulary for kids. Okay.
Yeah. Sometimes you can see it. If you just, some people said if you're learning English and watching kids film, it might be helpful. But apparently, the kids film is most difficult learning for the materials. That's my opinion. Because if you're watching for the Minions, there's some joke. It's quite adult sense of humor. The kids might have a clue what it might be. It's funny for the actions, but it's not fully understanding why that sentence is funny. Why this joke is funny for the adult, but I'm not funny. So sometimes it's not really good material to using for kids vocabulary, using for any animation film. But sometimes when you're talking for even this Japanese kids, you're talking in Japanese, and you can see for the baby word, it's really different, isn't it?
Yes.
Yeah. So maybe this is example you're using for your dog and talking with your dog for baby, but it might be no response to you, but it's something like that. Or if you have any niece or nephew, this is, or family members of someone's a child or baby, it might be talking to them, and it is in English.
Okay.
Practice. Very difficult to speak to pediatrics patients actually in English.
Yeah, and to be honest, in Japanese, even in Japanese, pediatrics is the field I'm terrible at. So,
Yeah. So
I need to practice. I know.
Dr. Tsukioka is really good. So you maybe need to contact with Dr. Tsukioka. And how did you learn the word? Or Dr. Kitahara?
Yes. Both of them are very helpful. Yeah.
I just stopped the recording now.